Hi everyone, Dr. Shook here. Hope you're doing well. What I want to share with you in this video is some information about a case that I'm currently working with. So whenever I start working with someone, I have them complete very extensive intake forms. So these intake forms are designed to gather as much information as possible because we want to look at dietary factors, lifestyle factors. We want to look at symptoms that could give us indications about dysfunction in every system. And I also like for them to share with me any recent laboratory tests that they've had done. I mean, even if it's within the last year or 2 years. And so in this particular case, I'm working with someone who has mixed connective tissue autoimmune disease and rheumatoid arthritis. So I reviewed their intake forms and I started looking over their labs. And one of the things that stood out right away was the fact that they had an elevated white blood cell type called monocytes. And this is something that apparently has been going on for years, and it's just been considered part of their presentation. And one of the things when you see elevated monocytes, the first thing that stands out to me and that I think about is, does this person have Epstein-Barr virus? The virus that causes mono or mononucleosis. That's why it's called mono, because it elevates monocytes, a particular type of white blood cell. That's not the only thing that can elevate monocytes. However, when you're dealing with autoimmunity, Epstein-Barr virus is a very common viral pathogen that triggers and can perpetuate autoimmune diseases, many autoimmune diseases. And in particular, when you're dealing with rheumatoid arthritis, Epstein-Barr virus has been shown in many scientific literature, in many publications, to be elevated in people with rheumatoid arthritis and to be found in the connective tissue, in the synovial fluid. There are a lot of the major joints of the body are called synovial joints, and they have fluid in the joints called synovial fluid, and it helps to nourish the joint, and it's a kind of lubrication for the joint. And they found Epstein-Barr virus at higher levels, at high levels in people with rheumatoid arthritis. So it is through an immune mechanism called molecular mimicry that rheumatoid arthritis may be triggering an inflammatory response in the joint. And so when this occurs, when the immune system reacts against the Epstein-Barr virus, the proteins in the virus, it makes antibodies. These antibodies, not only do they tag or stick to Epstein-Barr virus, flagging it as something that's foreign so that immune cells can more efficiently find it and eliminate it, but those antibodies may be able to tag some of your tissues, like the connective tissue. And this could, what this could do is, this could cause, if the antibody sticks to your tissues, then your immune cells just think it's foreign. They think that whatever the antibody stuck to, the complex of antibody plus tissue, is foreign. And therefore it reacts immunologically against that tissue, causing tissue destruction and inflammation. Now, that is one of the immunological mechanisms through which this could occur. Also, there's an immune mechanism called the bystander effect. So when a tissue is infected by a virus or a bacteria or a parasite, when that occurs and the immune system identifies the, let's say, virus, in this case, Epstein-Barr virus, in the joint, and it triggers an inflammatory response to try and destroy the virus and eliminate it, it may start reacting to surrounding tissues that the virus is embedded within or they're in close proximity. It's called the bystander effect. And that is where the immune system may expand to surrounding tissues that the virus is embedded within. And so the point here is, first of all, these things need to be recognized. Because if this has been going on for years, that is something absolutely that should be targeted. You can do, obviously there are tests. So one of the things that we are doing is I'm going to order an Epstein-Barr virus reactivation panel. So it looks at 4 different antibodies to tell you if it is a reactivation of Epstein-Barr. I could, based on the information that we have and its history, I feel fine just going ahead and implementing a protocol to support clearing or helping to target the virus a few different ways to inhibit replication, to help with clearing it, to help prevent its infection of the tissues. There are many different supplementation protocols that you can utilize to support dampening viral activity. Now, obviously, there are also medications that that his primary care may want to provide, which we'll coordinate with them and see what's appropriate. But the first thing is do we have a reactivation of Epstein-Barr virus? So I think it's reasonable to get a panel to check that and then go ahead and implement protocols. So we've identified what I think is already very likely to be a potential trigger and perpetuator of the autoimmune disease. And so this person has been dealing with this for years and years. We have to, in primary care, in specialties, in rheumatology, in all the specialties, we just need to have a bit more acknowledgement and recognition of these triggers, and acknowledging them and identifying them when you see something as clear as elevated monocytes, and that should be going off as, oh, there's a viral infection, very likely this. We know that viruses are triggers and perpetuators of autoimmune conditions. We know that if we dampen them, we might have an opportunity to decrease the immunological reaction against the person's tissues and improve the problem, actually by supporting a root-driving cause of it. Now, that's not the only factor, but I think that that is a very likely mechanism that this person is suffering with, having tissue destruction. And by the way, they're like weeks away from going on an immunosuppressant. Thousands of dollars likely per month to go on this medication. They're already on, low-dose prednisone for years and years, low-dose non-steroidal anti-inflammatories for years and years, and that's creating GI inflammation, increasing their intestinal hyperpermeability, or leaky gut as a lay term, that actually lets things from inside the digestive tract pass into the bloodstream, trigger an inflammatory response, drive an inflammatory reaction that can perpetuate autoimmunity, that can cause the immune system to start reacting to other things like food proteins that can then become perpetuators of this autoimmunity, that could lead to expansion of the autoimmune process. I mean, this is a pathological process that they can, absolutely, there's a good chance that they could you can dampen it by addressing triggers. Detect the triggers, remove them to the best of your ability, heal the barrier systems. The intestinal barrier is critical, the blood-brain barrier. I mean, we may be dealing with, in this particular case, neurological autoimmunity. The autoimmunity can expand through something called epitope spreading, and it's where basically it's just the immune system starts reacting to more and more things that have similar protein and amino acid structures, proteins in the body. And this is just, we got to do better than this. I mean, when you see, every single person needs to be aware, if you have an autoimmune disease, that there is a model called the environmentally induced model of autoimmunity that your condition needs to be observed, needs to be analyzed through, because it can help you to map triggers and drivers of the process, so that you can then implement dietary, lifestyle strategies, and whatever else needs to be done. Supplementation is common. Medication is a possibility too, depending on the problem. If there's a pathogen and there's a medication that can help to eliminate it, there's nothing. I mean, then absolutely, you want to remove the triggers. And when you do that, you have an opportunity to dampen the process. I mean, if you're lucky, put it into remission. But this is the kind of stuff that we have to do better at identifying these things. So I wanted to share this because I know a lot of people suffer with things like rheumatoid arthritis. And I can tell you right now, chronic infections, Epstein-Barr Virus is one. I talked about the other day, P. gingivalis, the bacteria, the oral bacteria that causes gingivitis. It's also implicated in rheumatoid. But so many autoimmune conditions have pathogenic triggers and perpetuators. So viruses, bacteria, parasites, fungi as perpetuators and triggers. Food proteins, chemicals can also be perpetuators and triggers. So there's absolutely things that can be done. But I wanted to share this because if you're dealing with this or someone else is dealing with this, you can get help. If you need help, you can reach out to me. I'll do everything I can to help you for free. I do work with people around the world, across the country via telemedicine. I help them dig into these problems, get advanced testing so that they can get to the root cause and try to reverse it if possible. But anyway,